Hello everyone. First, let's look at the dental DR. Animal body type, standard and thin. For dogs, generally select standard, with an exposure time of 0.5 seconds. Also, we can adjust the CUV and MA values. Tooth position, incisors, canines, molars. Settings. Select sensor. Power off. CUV and MA values are adjustable. Save after adjustment. Click remote pairing in the settings. Press the remote control button to confirm, as prompted on the screen. After positioning the animal, we can perform the exposure remotely. First, we shoot for the dog's upper incisors. Select the tooth position. Take the dog to be prone position. Then, insert the sensor horizontally into its mouth. Align the dental DR vertically with the sensor. Move downwards by 20 degrees. Then take the exposure. Now we can look at this image, mainly to check the tooth roots, for infection or abnormalities, for tooth fractures. Next, we'll shoot the dog's canines. Select the tooth position. If we want to photograph 100 for teeth, move the sensor slightly to the left. Then, position the dental DR perpendicular to the sensor downwards at a 20-degree angle. Then tilt it 20 degrees to the left. This is the image of the dog's canine. First, check for infection at the root. Then check if the alveolar cavity is closed. Check for tooth fractures. Next, we will shoot X-rays of the dog's molars. First, insert the sensor's outermost edge into the outermost edge of the molar. Then, position the dental radiator perpendicular to the sensor. Select the upper molar position. And take the image at a 45-degree downward angle. After exposure, the root image will be visible. Check for infection. Then assess whether the tooth is normal. Next, show how to shoot for the mandibular teeth. Select the tooth position. The dog needs to be positioned lying down. Generally, for cats or with large sensors, one single image can show canines and incisors. Then, the dental DR is placed perpendicular to the sensor, and the image is taken at a 20-degree downward angle. Then examine the mandibular canines down to the root, and the incisors down to the root for infection, and for tooth fractures. Then, we take images of the mandibular molars. Select the tooth position. First, the animal is positioned in a lateral recumbent position. Then, the dental X-ray is placed parallel to the teeth in the oral cavity. The dental DR and sensor are perpendicular to each other for imaging. This is the entire process for full mouth imaging. Check for infection. Clinical case.